A question I get asked a lot is during water birth, how do the babies not breathe underwater or essentially drown or have issues with getting water in their lungs when they're born? And the answer to that is partly it's not impossible for them to breathe underwater, but generally with the screening we do for low-risk healthy moms and babies, during the birth process, babies of course during the pregnancy are in water all the time and they're not breathing. They don't breathe air until they're born. They actually practice breathe amniotic fluid, and so they're used to that amniotic fluid coming in and out of their lungs, and that's how they learn how to use their lungs. When they're first born, they're still getting all of their oxygen from the umbilical cord from mom, and that placenta is still attached to mom, still delivering everything they need. And so as they're coming out of mom and into the water, they're basically just going from warm body temperature water into warm body temperature water that we keep at the right temperature for the baby. And as they're being born, they don't have that cold air hitting their face or hitting the nerves in their face that is what triggers them to go for the first time. And so they just sort of float up out of the water. We don't leave them under for very long. It's just a few seconds that they're in the water, but for those few seconds, they're still suspended in water just like they have been for the last 9 to 10 months. And they usually just sort of open their eyes and look around and stretch for the first time. And then as they come up and their face hits the air, then you'll see them kind of go above the water and they take that first breath. And for babies that take a little bit longer, some babies breathe right away, some of them take a few seconds more to come around and figure out what they need to do. They too are still attached to the umbilical cord, so even once they're out of the water, if they don't breathe immediately, they're still getting all that good, healthy, oxygenated blood flow that keeps them safe.